Hello, my name is Janet Miller, and I have been invited to talk with you on behalf of the St. Jude's Apostles Relay team about uterine cancer. Uterine cancer is actually a term for two different cancers, endometrial cancer and uterine sarcoma. Endometrial cancer is by far the most common uterine cancer and occurs in the lining of the uterus, which is called the endometrium. Uterine sarcomas, on the other hand, occur in the uterine muscle layer and connective tissue. Uterine sarcomas are rare and are a more aggressive cancer. Uterine cancer is the fourth most common cancer in United States women behind breast, lung, and colorectal cancer. Incidence rates are increasing, as are uterine cancer mortality rates. While more white women are diagnosed with uterine cancer compared to Black women in the United States, Black women are disproportionately diagnosed at a later stage than white women. Mortality rates are much higher for Black women compared to white women. While more aggressive and more advanced disease at diagnosis may contribute to this disparity, it has been suggested that access to care and inequity in standards of care are contributing factors as well. Risk factors differ between endometrial cancer and uterine sarcoma. Risk factors for endometrial cancer include older age and postmenopausal status. Endometrial cancer risk is predominantly related to estrogen exposures. Specifically, risk increases with older age at menopause, endometrial hyperplasia, which is a thickening of the endometrium, estrogen-only menopausal hormone replacement therapy, a lack of pregnancy, anovulation, and polycystic ovarian syndrome. Obesity is a major risk factor for endometrial cancer too. Insulin dysfunction frequently seen in obesity may also increase risk. Tamoxifen therapy used for breast cancer treatment increases risk of endometrial cancer, and there is also some association between height and endometrial cancer, which may be due to developmental factors. Certain genetic factors that affect endometrial cancer risk are a family history of uterine, ovarian, or colon cancer, Cowden syndrome, which is a genetic mutation causing benign and cancerous tumors in several tissues, and Lynch syndrome, which is a genetic condition that increases risk of several cancers, including uterine cancers. Unlike endometrial cancer, risk factors for uterine sarcoma are not generally related to estrogen. There is no screening protocol for most women for uterine cancer. Symptoms for endometrial cancer and uterine sarcoma are similar. The predominant symptom is abnormal uterine bleeding, especially after menopause. Uterine cancers are often found early because of postmenopausal bleeding symptoms. Upon diagnosis, the tumor will be graded. Grade 1 and Grade 2 tumors are well differentiated, which mean they appear more similar to the tissue that they came from. Grade 3 tumors are poorly differentiated and tend to be more aggressive and have a poor prognosis. Tumors will also be categorized as type 1 or type 2. Type 1 tumors tend to be grade 1 and 2. They have a better prognosis and are more often associated with estrogen, and they are predominantly endometrial cancers. Type 2 tumors tend not to be associated with estrogen. They tend to metastasize and they tend to be poorly differentiated. Treatment for uterine cancer may include surgery, radiation therapy, chemotherapy, and hormone therapy. Hysterectomy is common. A few targeted therapies are becoming available for endometrial cancer and uterine sarcomas, and immunotherapy clinical trials for endometrial cancer may be available. The modifiable lifestyle factors that reduce risk of uterine cancer include managing weight and eating a healthy diet with a low glycemic load. Exercise reduces estrogen levels, helps manage weight, and improves insulin sensitivity. Coffee protects against endometrial cancer by affecting insulin sensitivity and estrogen metabolism. Birth control pills lower endometrial cancer risk, especially if taken over an extended time. IUD contraceptive use is also associated with lower endometrial cancer risk if the IUDs do not also contain hormones. Thank you for being a part of today's event, and thank you for sharing this time with me to learn about uterine cancer. Be well. Thank you.